My name is Jordan, and I've been excited for quite some time to get involved with dry needling. It's recently become a pretty popular treatment technique, especially for muscle pain. So we're excited that we've been able to offer that here at Memorial. So dry needling is a biomechanical approach, which means that we're affecting the muscles to release trigger points. So at its base, we're getting rid of some of the knots in your muscle to return it to its normal resting state. We know that people get these trigger points, especially in their upper trap, especially if you have a desk job, and you just can feel that there's a knot. So at its core, dry needling is useful at releasing those trigger points.
My name's Liz, and I'm certified in dry needling. What you'll experience is what we call a local muscle twitch response. So during that, the muscle will contract and relax. It is not a comfortable sensation, but it's a quick, acute pain that won't last, longer than 1 to 2 seconds. So with that muscle, it kind of contracts, relax, and then you feel that eventual decrease of overall tension. So following the dry needling, a common side effect is a muscle soreness, similar to an intense workout, and would only last about 1 or 2 days.
It's not gonna feel good, but there's really, unfortunately, no pain-free way to get rid of a trigger point. This just happens to be the most effective. Some people opt to do trigger point injections, but of course with dry needling, we don't use any medication. The needle is just a needle. It's thin, it's solid, it's not hollow. So as Liz mentioned, it is a different, deep, diffuse, achy kind of a pain until you get that twitch response. But I try and assure people that any pain that you experience during needling, especially if your chief complaint, if that gets worse, that's a really good sign, and it's hard to convince people of that, but I tell them it's productive pain. If we can cause your pain, then it's most likely that we've treated the area that's been producing that pain all along. Acupuncture is an alternative Eastern-based medicine, and they utilize meridians and what they call acupoints that are predetermined spots on your body in order to manipulate your body's energy or chi to achieve whatever the desired effect may be. Dry needling is more focused at one spot in the muscle. Now you might have several of these throughout your body, but we release the trigger points in the muscle tissue, and that's of course not predetermined. So that could be anywhere along the muscle tissue, and we'll find it and we treat it exactly where the dysfunction is. Another big difference is that we only utilize one needle at a time. We keep our hands on that needle, and throughout the time that we use it, we might move it up and down a little bit, but that's the only needle that's in you. And oftentimes when you get an acupuncture treatment, you'll have multiple needles in you at the same time. So that's another key difference. So if you're wondering if dry needling is right for you, we typically tell people that muscle pain is a big part of physical therapy. You might say, when I move my shoulder like this, I have pain right here. That's typically different than muscular pain. Usually that muscular pain is hard to localize. Can't necessarily put my finger on it, but this whole area hurts. Or you might say down my arm or down my leg or wherever it may be. And those are typically when we get a lot more suspicious about myogenic or muscle pain. So we start to scan those muscles for trigger points, and when we find them, we can release them, and we're seeing really good results.
Some of the conditions that have been successful with dry needling have been things such as plantar fasciitis, chronic type headaches, nerve pain that might go down the leg or arm, tendinitis, and overall muscle tension. I would say my most successful story would be with a patient who had chronic headaches for over 40 years and medication wasn't working, previous physical therapy wasn't doing the trick, and we dry needled, several spots into the neck and, the upper trap muscle, which actually alleviated her headaches completely and didn't have to take her pain medication any longer.
If you've had a headache for 40 years, you're gonna have to stick with us for a little bit of time. It's anywhere between 2 to 6 weeks, but you really should notice some symptom reduction within your first couple treatments. It might not all be resolved, it might not all completely go away, and we might have to go to different areas. But depending on how long you've had pain and how significant or widespread the dysfunction is, how many trigger points there are, is gonna affect your treatment period, anywhere from, like I said, 1 to 2 weeks up to 6 to 8 weeks.